Can you imagine having a whole list of symptoms and having your doctor dismiss your concerns because your lab work is normal? This type of medical gaslighting happens far too often, but thankfully, there's another path to get the answers you've been looking for. Welcome to the WTF podcast, friends. My name is Molly Smith, and I'm on a mission equipping a million people with the tools to recognize when they're in the funk, but more importantly, how to pivot out of it. By tuning in today, you have joined me on this mission, and I am so grateful that you are here. My guest today built her career on knowing how to stay healthy and fit. As a former gym owner and fitness expert, she understands how to take care of the body better than most. Then she was hit with one major health issue after another. The doctors who were supposed to have the answers kept telling her the same thing. Your labs are normal, you're fine. Jamie was anything but fine. When the medical system kept dismissing her, she went on to become an expert herself. And what she has built on the other side of those experiences has helped thousands of people who have heard the exact same thing from their doctors, including me. Jamie has a PhD in integrative medicine and is the founder of the Heal Your Body Clinic, where she has become a leading voice on thyroid conditions, hormone health, and autoimmune disease. Please join me in welcoming Dr. Jamie Gilliam to the WTF podcast. Hello, my friend.
Hi, I'm so excited to be here. Thank you for having me.
You guys, this is a classic story of somebody truly being in the funk and turning it around and making it a life mission. So I am so excited to share Dr. Jamie's story with you today. And she is my doctor, by the way. She has changed my life. And she is lovingly referred to around my house and with my friends as Dr. Jamie. Okay, so we're going to dive into your story because it is truly remarkable. But before we get into some of the health things that came up for you, what was life like for you?
Prior to getting a diagnosis and going through all of my health struggles, I was fine. I was thriving. I will say that in reflection, I had a lot of childhood illnesses. I had
Oh,
chronic ear infections. I had chronic leg pain, knee pain. I was on
mhm.
amoxicillin for most of my childhood through my teenage years.
Yeah.
And there was a lot going on in my home, a lot of fighting, a lot of issues just within my childhood that I thought all of that was just completely normal. And it wasn't really until I started doing a lot of healing work that I recognized that I had been living in chronic stress and overwhelm for all of my life. And I think that's a big part of, especially when we talk about autoimmune diseases, I
Mhm.
think that all of that really played a role in me developing multiple autoimmune diseases.
Yeah.
But otherwise, life was great. I had five babies. I got two bonus children when I married my husband. We were running a gym, which was extremely stressful.
I believe
And
it.
outside of that, I thought all you needed to do to manage your health was exercise and eat well, and
Mhm.
that would prevent the majority of diseases. And
Yeah.
then all of a sudden, my life got turned upside down.
Okay, so what were the first signs that something was wrong?
So I started having a lot of neck pain that would radiate up into my jaw, face, and ear. And I was having these muscle spasms on the right side of my face. And I was having trouble swallowing. It would feel like there was something in my throat. I was randomly choking on food. So I would just be
Huh.
eating something and I would choke for a few seconds to where I literally was choking, and then it would pass. And then the rest of the day, it would feel like there was like a chip piece in my throat or
Oh,
something. I
God.
would be constantly clearing my throat. And I was waking up in the middle of the night feeling like I was choking. All of my symptoms were really just centered around something is in my neck,
Yeah.
and whatever's going on is radiating from my neck. I kept going to a clinic and I was seeing different providers within that one clinic,
Yeah.
and they just kept telling me your labs are normal. you're fine, you have anxiety, and you're having panic attacks when you're choking. At one point, I went to the ER because it was the first time that I had the muscle spasms in my face, and it was on the right side, and the pain radiated down my arm. So I think I'm having a stroke.
Yeah, exactly. Oh my gosh.
And yeah, and I go to the ER and all they did was a CT of my head. They gave me Ativan and said I was having a panic attack. I'm saying, "Hey, I don't think that this is a panic attack." My husband, I remember him saying, "Well, babe, you are kind of stressed." And my husband's extremely supportive,
He
but
is.
I was really upset in that moment
Oh,
because I didn't take the Ativan. I knew in my heart, in my body, something kept telling me there's something wrong. I just had to keep searching. I wasn't searching for answers at the time. I think back then, Google wasn't as popular.
yeah,
Like, I wasn't doing a lot of searching online,
yeah,
but I kept going back to the doctor's office saying, "Hey, I'm still having these issues and I'm
yeah,
scared. I'm scared to eat. I'm afraid I'm going to choke to death in the middle of the night."
yeah.
It was a little bit over a year. It was about a year and a half before I finally got a provider to just do an ultrasound.
Okay, so I alluded to this in the intro. This constant dismissal, this is the first of at least two times that I know about where you have been dismissed by your doctors.
Mhm.
Is that right? Okay, so what happened and what did you ultimately uncover?
I think I went about a total of 6 to 8 times, and it was, "Your labs are normal, you're fine, it's anxiety." And then one of the providers said, "Maybe it's a muscle strain," because they knew that I worked out all of the time. And
Okay.
then another time, that same provider said, "Maybe it's a vocal cord strain." I don't understand why they wouldn't just do the imaging when I was complaining that, "Hey, I think there's something in my neck." But they ran the bare minimum for testing, your CBC, CMP, lipid panel, A1C, which won't show really
Anything on the
anything that's going
thyroid?
on. um, and they did run a partial thyroid panel, which
Mhm.
looked okay. So after going so many times trying to get help, I started feeling like a nuisance and it was creating anxiety. So I was struggling with anxiety because I was having these symptoms and I'm thinking something's wrong with me. And
Right.
then I'm having anxiety going to the doctor because they're treating me like, "Oh my goodness, why are you here again?"
Yes.
And it's a 10 to 15-minute appointment where they're not really making eye contact. They're sitting at their computer, like typing out information and really just making me feel like I'm a bother. And
Hmm.
I'm not saying that, listen, there are some great MDs, nurse practitioners, providers in conventional care. And we have a nurse practitioner that we work with directly. There are some fabulous conventional
Hmm.
providers, but I just think that the system as a whole, part of the problem is the focus is on running basic diagnostic testing
Right.
and assuming that everything is fine, and it's rare to have a serious problem.
Yeah.
And so a lot of things are missed. So when I got to a point that I was basically drinking protein shakes because I was afraid to eat solid food, I was afraid to sleep because I was worried about waking up in the middle of the night choking, I found a new provider. I just found a different clinic. She was brand new, young provider. I told her what was going on. She said, "Well, let's run some labs." I said, "I just need you to look in my neck. There is something in my neck. I'm telling you, there's something there." She said, "Well, let's run the labs first." She ran my thyroid panel. She ran some other labs. She called and said, "Everything's fine. We don't need to do any imaging." I said, "Somebody needs to look at my neck." So she sent me for that ultrasound. And
Oh,
that was on a
goodness.
Friday.
Okay.
They said they'd somebody call on a Monday or Tuesday and let me know the results. Well, she must have been on top of it because usually, like, it doesn't even get sent to radiology immediately.
Right.
But she called me before I was even home within 20 minutes to tell me, I'm 99% certain you have thyroid cancer. You need a fine needle biopsy. She asked me if I could come back in that day, and I was in so much shock. I said, no, I just need a breath. I'll come in on Monday. So that's how that all transpired. And one of the biggest things, too, is she didn't tell me anything about thyroid cancer and the prognosis. So
Oh,
I'm
yeah.
thinking I'm going to die. I'm
And you went into the
thinking,
weekend with that?
yeah, I didn't know anything, just like most people, that
Yeah.
thyroid cancer is a very treatable, survivable cancer for the majority,
Mhm.
unless you have an aggressive type, which is more rare. But
Mhm.
all I was told was 99% certain you have thyroid cancer. I wish that it had just been relayed, hey, you're going to be fine. This is a very treatable, survivable cancer with a
Yeah.
90% survival rate, you know. So that I think was something that I've really kept in mind
Mhm.
as we work with patients
Mhm.
to educate and reassure people and help them understand what the diagnosis is
Mhm.
and what life looks like long term with that type of diagnosis.
Yeah. And honestly, as a practitioner, having firsthand experience probably really shapes how you show up for and how you communicate with your patients, right? And a lot of doctors don't have that. They don't have the firsthand experience or knowledge of the disease that they're treating. Okay, so you had a thyroidectomy,
Mhm.
thyroid removed, and then what did they do following the thyroidectomy?
So I had a thyroidectomy within 1 to 2 weeks. It was very
Pretty quick.
fast,
That's good.
mostly based, I think, on my symptoms
Mhm.
and the margins at where the cancer was, and it hadn't spread to my lymph nodes yet,
Oh, thank
but
goodness.
it was close.
Mm.
So I had the surgery. I was told, we're going to put you on levothyroxine. You're going to be fine. I wasn't fine. The
Okay.
surgery was very simple, easy to recover from,
Hmm.
but I quickly declined. So all of my symptoms subsided. Another symptom was I was having trouble catching my breath. It felt like air wasn't getting down into my body. It was, but it felt like my breaths were very shallow. So
Right.
that went away. The trouble swallowing and choking, all of that went away.
Perfect. Okay.
I was back at the gym within 3 days, just walking on the treadmill. I wasn't doing any lifting
Yeah.
because all of that can obviously, your neck is involved with, your whole body's involved with movement. But I started walking for the first several weeks and I started having a lot of pain in my hands and my feet, my knees. I started having a lot of brain fog,
Okay.
trouble remembering complete conversations and things that had happened. I couldn't
Yeah.
remember even simple words when I was speaking to people. I would have
Yeah.
to, it would take a few seconds. If I was talking about a
Yeah.
pen,
Hmm.
I couldn't think of the word, and it's like my brain was moving slower than my mouth.
Right.
And I had headaches every single day. And I would run to the bathroom about 30 minutes after I would take levothyroxine every day. Every day, my body felt like it had been run over. The fatigue was like a deathly fatigue, not just like normal, I'm tired, didn't get enough sleep.
Yep.
And I started having vision problems over the course of several months.
Okay.
My vision declined, my dental health declined, my tongue was swollen, my mouth was irritated, my mouth was burning. I was having a lot of trouble being cold all of the time. And then if it was hot, I couldn't handle the heat and
Wow.
digestive issues. My hair fell out. I lost about half of the volume of my hair, not the length, but half of the volume. I
Oh my
lost all
gosh.
of my eyelashes and then my skin was dry, my nails, and I gained 20 pounds. And at that 20-pound mark is when I said, I can't do this
I'm
anymore.
done.
Yeah,
How
I'm
long
not
of a
going to live
time
like
period?
this.
How long of a time period was that?
It was about 6 to 7 months.
Okay. Okay. So did you find which who was your doctor then? Like, were you using the same doctor, the one who got you in for the no, different doctor.
So that was a
Okay.
primary.
Okay.
And then I had a surgeon. They
Yeah.
also sent me to hematology, which I don't even know why he was in the picture
Yeah.
because he wasn't really involved at all. They send you usually to endocrinology
Yeah.
post thyroidectomy. She was supposed to be one of the best in our area.
Hmm.
And I gained that 20 pounds rapidly. So it was about 6 to 8 months where
Yeah.
I
Yeah.
decided I can't keep living like this. But
Hmm.
that 20 pounds I gained within the first few months. It was pretty
Yeah.
rapid. And then I kind of stalled because I was working out, working out, working out. I was eating less and less and less, trying to manage, and nothing was working. So I keep telling my endocrinologist, hey, something's not right here. I'm gaining weight and I own a gym and I'm having all of these symptoms. I feel like crap. And
Yeah.
she just kept telling me, your labs are normal, you're fine. And at one of the visits, she said, you just need to diet and exercise. And I said, I'm already doing all that. I don't think you understand.
Yeah.
I'm in the gym at least an hour a day, six
Yeah.
days a week. I
Yeah.
can't do any more and I
Yeah.
can't eat any less.
Yeah.
So at that point, I sat on the side of my bed one day and I remember it so vividly because I thought to myself, I'm not going to live like this the rest of my life. I
Mm-mm.
can't live like this the rest of my life. And that's
Yeah.
really when I started researching and recognized that I don't really know anything about hypothyroidism. I don't know anything about this condition.
Right.
I've been trusting this endocrinologist who is not listening to me.
Yeah.
And that's when everything began to move forward. But then I had other health
Yes.
problems along the
Yeah.
way.
Make sure everybody's tracking here. This is the second time that she has been, I'm calling it being medically gaslit by her doctors who are dismissing her symptoms and relying solely on the like typical ranges in lab work. Okay. All right. So tell us where it turned a corner where you were able to get some more information.
So, first, I started focusing on holistic care
Okay.
because I was really angry with conventional care.
I would have been too.
Another piece of the puzzle is my mother had passed away from colorectal cancer prior to my diagnosis of thyroid cancer. She complained for 2 years of symptoms. Her primary care provider kept telling her that she had hemorrhoids. If they had done a colonoscopy when her symptoms were first developing, they would have caught her colorectal cancer at a much earlier stage.
Yeah.
And she had had a colonoscopy, but it was within a 10-year time frame. So insurance wouldn't cover
Wouldn't pay
a
for it.
colonoscopy.
Yeah.
If they had pushed harder, maybe so. But by the time my mom was diagnosed, she was terminal. She was stage 4. So that's another piece that when all of that was occurring with my mother, I still didn't see the light that
Yeah.
hey, she was dismissed.
Yeah.
And as I'm going through this whole process, a light bulb went off that, hey, you're going to have to advocate for yourself and help
Yeah.
yourself because
Yeah.
it's not that they don't care about you, but they're just following their guidelines. They're checking the boxes. They're doing the
Yeah.
bare minimum. And
Yeah.
my mom might still be alive today if they had diagnosed her in an earlier stage. So I was
Absolutely.
very angry. And
Yes.
I didn't want to see another MD or nurse practitioner
Yeah.
again.
Yeah.
So I'm thinking I'm going to do this holistically. And I did 2 different holistic practitioner certifications. I started diving deep into the holistic world and realized that I have to be on thyroid medication for life because I don't have a thyroid,
Right.
and started talking with different people, connecting with people to learn. I started doing a lot of research online, learned more about full thyroid panels, combination T4, T3 treatment, and also the importance of comprehensive labs, looking at
Yes.
the body as a whole. I connected with a PA who ran comprehensive labs on me, and they were a hot mess. They were not good. So my thyroidectomy, I think combined with the grief of losing my mother and the
Mm,
chronic stress that I was under caused a cascade of problems
yeah.
in my body.
Yeah.
And I was severely hypothyroid on levothyroxine. I was being treated,
Yeah.
but I had severe hypothyroidism due to improper treatment. I had zero testosterone, and my progesterone was very low.
Mm.
And my estrone, which is a different type of estrogen than estradiol, was very high. It was in the 200s, almost 300s.
And it's supposed to
And
be what
it should be
ish?
somewhere under 60.
Oh.
So it is mostly made by your fat cells. It is
Mm,
estrogen mostly made by your fat cells, but
okay.
that also increases risk of all different kinds of cardiac problems and other problems. My LDL cholesterol was also high, and I was pre-diabetic even though I was working out all of the time. My ferritin was high, which it can be an inflammatory marker.
Response. Yeah. Hmm.
And I had Hashimoto's, which nobody had tested me for post thyroidectomy. I did not have Hashimoto's prior to my thyroidectomy, but post thyroidectomy, I developed Hashimoto's,
Oh, interesting.
which my endocrinologist thought you can't have Hashimoto's post thyroidectomy, which is not true. So when I went in for a recurrent screen with her, she argued with me about that, and I had to show her my labs. And then I got put on T4, T3 combination treatment for hypothyroidism
Yep.
and testosterone replacement, progesterone replacement, and holistic care. I began to get my life back and I started losing weight. Then, even from there, I was diagnosed with lupus and rheumatoid arthritis later on. But still, I've been feeling great and thriving ever since I got put on the right combination T4, T3 treatment, hormone replacement, and just looking at the body as a whole and
Yes.
adjusting some lifestyle things to reduce the physical stress on my body with workouts.
Yeah.
There's certain things I don't do with workouts anymore. I don't overload my schedule. And if we go on vacation, I've got to take some breaks. So there's certain things that I've learned to do to
Yeah.
avoid stressing my body, which then can cause autoimmune flares more than anything.
Right. Oh my gosh. So, first of all, the thing that I love about Jamie and what she taught me even was one, how to read my lab work. So, I know how to read my own lab work. And actually, I have a great conventional doctor. She's lovely. She will never treat my thyroid again. Her medical education taught her to look at TSH and T4,
Mhm.
and that's it. And
Like
that's like a
levothyroxine only.
yes, yes, but that's all she was trained to do. So I can't really fault her for that. And I've gone into her and she's run blood panels and I'm like, hey, run a full thyroid panel. And she's like, okay, I'm happy to run it. And she's like, what do you want me to run? And I'm rattling it off because Jamie taught me what to ask for. And she literally said this to me. She said, I'll order these for you, but I don't treat based off of them. I'm like, no, no, that's okay. I can read my own labs. She didn't have the knowledge on how to look at a full thyroid panel and understand what it's saying. So Jamie had the exact same experience with her endocrinologist. So if you have thyroid disease, having that education and that knowledge is so, so, so important, and advocating for yourself as well. So, looking back, what was harder to carry for you? The diagnoses themselves or not being believed by your doctors?
Not being believed and being made to feel like
Mm,
I was crazy
yeah.
and that it was my fault, that I just needed to work out more and eat less when I'm saying I'm struggling with my weight.
Yeah.
And I just need to calm down and manage my stress with all of the other symptoms. It was relayed to me that it was because of something I was doing. And
Yes.
here's some anxiety medication. If you want it, you can take it. I also struggled with the fact that there was no education on this is the condition that you have. These
Mhm.
are the symptoms of the condition. These are the different treatment options available that we can try. If you're not improving, come back and let's try something different.
Right.
That's what I think should happen. If something's not working, maybe we need to investigate further and see if there's something else going on.
Yeah.
But instead, I was just put on a medication and told that you're fine. Bye bye and come back in a year.
Yeah.
And when I kept going back saying, hey, I'm telling you something's not right here,
Yeah.
she just kept saying, your labs are normal, you're fine. I can't tell you how many times I've heard that statement. It is extremely frustrating when you know
Yeah.
that your body is telling you something's not right. And especially when you're working out, you know that you're managing your nutrition and you are not managing your
Yes.
weight and your body's changing. It is the most frustrating thing because I had been
Yes.
in the fitness industry for so long. I've had 5 babies. I've always been able to manage weight, and I gained 50 to 80 pounds with each pregnancy,
Yeah.
was able to lose it with exercise and nutrition. So when that was no longer working, I'm saying to myself, this is not right. Something's going on.
Right.
My life turned around within 7 to 8 weeks once I got on proper treatment. It
Yeah.
was a very fast turnaround, especially because I was in the gym. I was doing the things. I was
Yeah.
on a very restrictive diet at the time. So that combined with proper treatment, speeding up my metabolism with the
Yeah.
combination T4, T3, it gave me my body back pretty fast. I started feeling so much better. All the symptoms started subsiding. And I will say, I had a puffy face for a very long time, even after I was properly treated. It's a
Okay.
long time. That's myxedema. It's swelling of the face. It's water retention. That took quite a long time to subside. I think I had optimal thyroid values, but I think my thyroid signaling
Mhm.
where your thyroid hormones getting into your cells. I think it took a while for that to improve.
Yeah. Oh, fascinating. Okay. The other thing here that I think is so important is that Jamie isn't advocating, nor does she tell her patients, and I'll just use myself as an example, to not use conventional medicine, right? It truly is a combination of conventional medicine, looking at functional ranges, and holistic care, because at the end of the day, everything is freaking connected. Your liver values are connected to everything else that's going on in your system and your thyroid and all of that. So when you go to a specialist, they're looking at just one thing, they're not looking at everything else. That's a problem. That's
Yeah.
a problem, right? For reference, I found Jamie on TikTok. I must have been looking for thyroid or just Hashimoto's because I have Hashimoto's disease. And she came up in my TikTok and I was like leaning in. And then I went and binged all of her content and then reached out to her because what she was saying was exactly what I was experiencing with my doctor. And I was feeling
Mhm.
miserable and had to wait 6 weeks to get my labs rechecked before they would take a look at my medication and my dosing and all of that. All right, I'd love to know when you realized that this was going to become your purpose.
I think it just kind of happened. So, to back up, I got very holistic focused.
Okay.
And as I was connecting with different people, connected with my PA, I recognized that conventional care is extremely important. And there's a bridge that needs to be built between the holistic, integrative side. Well, integrative is a combination of both.
Mm-hmm.
Integrative means you respect all treatment modalities and you're evaluating determining which treatments are best for an individual based on their personal needs. So there's not a treatment modality that is off the table, right? If
Right.
it can be useful.
Right.
And I'm going to side note, try to stay on track. But one of the problems right now, we have a lot of people in the natural wellness space who are
Yeah.
very against any kind of medicine, against
Yeah.
diagnostic testing, cancer screening. And
Yeesh.
that is extremely problematic.
Yeah.
And then we have MDs and MPs and all of the conventional providers who are very against any type of holistic
Holistic.
approach, which I think stems from a lot of the pseudoscience that is being spread. And it's
Yeah.
just misinformation.
Yeah.
What needs to happen is a respect for both worlds and the respect for all different types of treatment that can be beneficial.
Right.
Like acupuncture may be beneficial as part of somebody's treatment protocol, but somebody else, it may not be
Right.
the best option. That needs to be understood. So, as I would meet people and talk with people, and I'm digging into research, I'm reading books, I'm doing these certifications, that's when I shifted more to integrative
Mhm.
because I recognized the importance of conventional care. And that's when I went back to school to study, which at the time, it was still only to learn for my own benefit. I was still doing fitness and nutrition
Okay.
and helping people with exercise and nutrition. As I would train people, they would have hypothyroidism. They would be in perimenopause or menopause. They would have an autoimmune disease. And I would say, let me tell you about what my experience has been.
Right.
My PA, he mentored me and really taught me a lot about thyroid panels, combo meds, hormone replacement. And I learned a lot from him. And then I learned a lot actually from one of the holistic programs, taught quite a bit about hormone replacement and the value in that, but also the value in holistic care alongside it or for women who aren't candidates for hormone replacement.
Right.
And then a lot has just been through researching, talking with different providers, working with different providers. There's so much research available if you know how to navigate it. So from there, as I would talk with more and more people I was training, it just kind of fell in my lap that, hey, all of these women and men aren't getting proper care and they're struggling. And I can only do so much when it comes to helping somebody with their weight, with
Yeah.
their exercise and nutrition, if they're not properly treated for a thyroid issue, for autoimmune, for any kind of endocrine problem, which is all hormones,
Right.
then autoimmune is directly linked to hormones.
Mhm.
So it all plays into one ball of wax. That's kind of what led me to just opening up a clinic.
So you got your PhD in integrative medicine.
Mhm.
Did you do it with the idea that you were going to open up a clinic and start helping people?
No, I just wanted to learn for myself,
Oh my
and
gosh.
I wanted to be able to include it with training and
In
exercise
fitness.
when needed. It just so happened that I ended up leaving the fitness. I still teach group fitness, but I don't train at a
Yeah.
gym or anything like that. We closed our gym,
Yeah.
which that was a blessing. We really did not like owning a gym. That's a whole nother podcast.
Yeah. Yeah. Yeah.
But I don't work at a gym anymore, except for I teach a few fitness classes as a hobby, but I do include nutrition and exercise programming as part of a complete protocol for all of our patients. So that is part of treatment along with holistic care and any medical care, which all of our medical care, any medications are prescribed by our nurse practitioner.
You have a wonderful setup. Wonderful setup. Okay. What do you know now about your own body and your own instincts that you couldn't have put into words before all of this happened?
First of all, I think conditioning plays a huge role in our lives.
Oh,
I
yeah.
think we are conditioned from the time we're born based on our environment, what our parents believe, the way that they treat us, the way other people treat us, our interactions. There's society and that influence.
Yeah.
So I think conditioning, we have to recognize that we have to think for ourselves and think outside of the box.
Yeah.
And sometimes what's normal for us isn't normal. It's just normal because it's all we know. Part of my healing has been trauma healing,
Oh,
mindset
yeah.
work, nervous system regulation. And when I started that journey, I recognized that I had no idea that I had childhood trauma. I had no idea that I couldn't set boundaries, that I was a people pleaser, and
Mhm.
I lived in constant chaos mode. All of that was just normal because it's all I knew. I thought my family was completely normal. I
Yeah.
thought everybody's family operated that way. I think there were times when I was younger where I liked to be at other homes and I got very involved in church. I think because I wanted some of what
Yes.
I saw and that
Mhm.
feeling that I had that I didn't have at home.
Yeah.
And this is no disrespect to my mother because my mother loved me and my brother dearly, but there was a lot of chaos and
Mhm.
I learned to survive early. I learned how to be quiet. I learned how to navigate and not make people angry.
Yeah.
And understanding that has helped me tremendously as I'll be 50 next month to not be a people pleaser and
Yeah.
to set boundaries. And it's okay to say no. It's not rude to say this is not okay or no, I can't meet you for coffee or whatever the case
Whatever
may
it
be.
is. Yeah, absolutely.
So I think that's one thing. You have to recognize that you have to seek answers for yourself. You have to really understand yourself on a deep level and open your mind to the possibility that there's more outside of what you've been conditioned to think and believe and follow and all the things.
Mhm.
I think the other thing is your body is telling you something when something doesn't feel right. It's a way of your body signaling to you when you have symptoms that, hey, red light's going off. You know, there's a
Mhm.
problem. It's like, wah, wah. That's what it's trying to tell you, right?
Yes.
But we ignore those things. And a lot of people just keep going and keep going. It should be a red flag or a red light saying, hey, you need to pay attention to this because it's an indication that there's something going on that needs attention.
Yeah.
And the other thing would be intuition. I think that we are taught at least I was, we're taught at an early age to disregard our intuition and to,
Yes.
just bury it.
Yes.
And my mother, before she was diagnosed with colorectal cancer, I remember her sitting on the couch and saying to me, I know there's something wrong. There's something not right. I can feel
Yeah.
it. And when I was going through the thyroid cancer ordeal, I knew that there was something wrong. And it began to really eat at me because I knew in my soul that there was something wrong with me.
Yeah.
And I've had so many times in my life where I have ignored intuition in different scenarios, out in public or with,
Mhm.
interactions with people, all different types of scenarios.
Yeah.
And I've learned now to hone into that and understand that we're all given that for a reason. It's a
Yes.
guide. And some
Yes.
people call it Holy Spirit or, God or intuition, whatever you want to call it. It's there and we can't ignore it because it's leading us to help us avoid serious problems in our life.
Yes. I
Yeah.
totally agree. I totally agree. For somebody who either is sitting in a doctor's office or has recently been on the other side of a conversation with a doctor who said your labs are normal, but you're still feeling like garbage, what would you want them to know right now?
That you're not crazy and it's not
Yeah.
all in your head.
Yeah.
You have the ability to advocate for yourself. And now, in this day and time, there is a wealth of information available to you online, which I think is difficult to navigate when you don't know how to understand what is true and what is not, because there's a difference between differences of opinion between treatment
Yes.
modalities and testing and what is not backed by any evidence at all. But there is a lot of information available to you. And if something doesn't feel right and you're not getting answers, you need to seek a different provider. You need to try a different approach. For me, I know we had talked about this when how I felt about trying something different or,
Mhm.
switching the approach. When my endocrinologist was not listening to me, which I also went back to my primary, I also contacted the surgeon and the hematologist trying to get help, and they all said, "You've got to go back to your endocrinologist. We can't help you."
Yeah.
I was at a point of desperation where I didn't care if it was dangerous. I didn't care if
Yeah, exactly.
I didn't care how risky it was
Yeah.
because I wasn't going to live like that. And I was willing to take a risk. I had studied in depth the T4, T3 treatment protocol for hypothyroidism and the
Yeah.
different way to look at thyroid panels. I said, what's the worst that can happen? I'm not going to feel good. And so
Already
I'll
there.
try something else.
Yeah.
And so you've got to understand that when you don't feel good, if you're not getting any answers, you have to keep moving forward, searching for the answers. One of the things that we do is we start off with comprehensive labs. We start off with looking at the body as a whole with comprehensive labs. And then we're also looking at labs from a functional range standpoint versus a normal range. And
Yeah.
we're also evaluating your history, your symptoms, and your lifestyle management. There's a lot that we're looking at because we're looking at the body as a whole.
Mhm.
And sometimes we refer to specialty care. Sometimes we refer for additional testing or imaging based on what we find or based on what we're being told by the patient when it comes to symptoms and their different struggles. So it's upfront a more comprehensive approach
Right.
versus, hey, let's just run a urinalysis. Let's just run your TSH or your CBC and then say,
Mm.
oh, these are normal. You're fine. Come back in 6 months or a year if you're still struggling. We just want to take a preventative approach. Then we're monitoring. We are staying in close contact as a patient goes on treatment so that we can make sure that the treatment is working. And then we have retesting of labs at usually 6 to 8 weeks
Yeah.
of anything we're treating, anything flagged in labs to make sure that that treatment plan is working. Some labs, it takes a little bit longer for them to truly show effect, but initially we can see some change. Then ongoing, we continue to monitor. So what happens with most people is you go in, you do an appointment, they'll run a few labs, tell you you're fine or give you a medication, and then they say, we'll see you in six
Whenever.
months or a year.
Yeah.
Where you really upfront, I wholeheartedly believe you have to have more of a close monitoring situation where, you can say, hey, I'm still not feeling right, or I'm having these symptoms, but these things are improving.
Mhm.
I'm still not losing weight, or yeah, I've lost a little bit of weight, because then you can monitor and make adjustments as needed based on patient response. And you've got to put your health before everything is the one thing that I will say. You have to understand that you live in your body and you get one body and you get one life.
Yeah.
I feel like people put more focus into their hobbies,
Yeah.
or if they're taking care of their kids or sick loved ones, or whatever's going on in their life. A lot of
Yeah.
times people put everything before themselves, which is another reason why many women end up chronically ill, because they're
Yeah.
just not putting themselves first.
Yeah.
But, you've got to invest in your health, and you've got to take the time for both preventative care, then treatment for conditions that you do have. And for most health conditions, there are multiple treatment options, and then there are combinations of treatments that people just are unaware of.
Right.
You should be given that information and a choice. Even with hormone replacement, there's different delivery systems, there's different types, and there's things that you should be aware of. And then you should be educated on which is best according to data, and
Yes.
also what you should be monitoring when it comes to possible side effects and different things. But a lot of women and men are just thrown on HRT and they're not told anything except for
Right.
here you go.
Right.
So you've got to advocate for yourself. You need to be educating yourself. You need to be listening to your body. You need to be monitoring your symptoms, any improvements when you are put on treatment, any side effects. And you've got to become very self-aware, and you've got to fight for yourself like you would fight for your kid,
Yes.
for your best friend, for whoever. Because a
Yeah.
lot of times I think, especially for women, we tend to fight for everybody else before we fight for ourselves.
Yeah. I couldn't agree more. I couldn't agree more. All right, you guys, if Jamie's story resonated with you, or you know somebody who is going through a health challenge or isn't getting the care or conversation that they deserve from their provider, please forward them this episode. It might just help them take their next best step. And every time you share the WTF podcast, you're helping me get closer to reaching the 1,000,000 people I'm on a mission to serve. So thank you for being a part of that. As always, please rate, review, and subscribe wherever you are watching or listening. Until next time, keep pivoting out of the funk.